So, Dr. Quinn, give us the details of how a doctor referral really goes down.
Well, you know, it's so interesting. I had this conversation just a week ago with a young lady, and she was very upset. She conveyed that she didn't understand why I sent her and her sister and her brother to the same cardiologist where they all got bills. And she asked me, she said, Dr. Quinn, are you getting paid under the table? What's going on? Why don't you send all of us to the same cardiologist? And what I explained was, in the history of all three of the siblings, their father had a congenital heart condition of which he lost his life. And they all had symptoms that were suggestive. And I explained that the cardiologist I referred them to had the equipment and the training to not only identify if they had the same heart condition, but he could properly treat them so that they could not have the same fate as their father. And I explained that this is very standard and is good care, and it's because I cared about her and her siblings.
Yeah, that's really interesting. Is there some type of, I guess, relationship building, though, that does kind of go into doctor-doctor and referrals and stuff? Like, hey, I know this guy's a good guy. I know he's a good person and he's going to do you right. Or you send him to a doctor just based off what they have.
Well, basically, the deal with this is I've been in practice as a family physician for 22 years right here in Mississippi, and a lot of stuff in life is trial and error. You refer a patient to a specialist, they do a really bad job, you don't refer to that specialist anymore. But if you refer to a specialist that does a great job, then you'll keep referring to that specialist. I have a specialist that I just got finished explaining about that treats breast cancer, and a patient came in just 15 minutes ago. She was crying, she had an abnormal mammogram, and she needed follow-up. I called the doctor on the phone. His name is Dr. Timothy Apston at St. Dominic's, and he said, send her today at 3 o'clock. He's gonna do an ultrasound, and if she has breast cancer, it'll be identified today. He'll schedule her for surgery maybe next week, take it out, and I explained to her that her life could be saved.
Yeah, that's a great story, actually. And you talk about just, first-person stuff. I mean, it's right there. So I guess my next question would be, we talked about the legal parts of this and the unethical, ethical parts of this. Can we dig a little deeper into that?
Well, here's the deal. There's something called stark anti-kickback laws. And if it's determined that the specialist is giving money or any type of financial benefit to the primary care doctor that refers, then that doctor will be prosecuted. I've known doctors that have gotten prosecuted over my last 22 years of being involved in that type of activity where they got kickbacks. And these doctors not only lost their license, but one of the doctors did jail time. And Dr. Quinn don't want to go to jail. That's not good look for me. I don't want to. No.
Hey, you've already been through enough. You can't have brain surgery and then go to jail. I feel like that would be, Dr. Quinn, that would not be good for our show, and that would not be good for you.
I don't know how to fight. They'll be like, hey, what are you gonna do? I'd be like, no, I'm sorry. I don't want to go to jail.